Hi, my name is Clarissa Reynolds, and I did my capstone project on occupational therapy in maternal health, awareness, and access. So, in terms of background and literature review, I found out that the US currently holds the highest maternal mortality rate amongst other countries, and I really wanted to understand what factors are going into this problem and how we can potentially fix this and provide better outcomes for moms. So, right now, what I found out was that current literature really examines the role of OT in maternal health and what that looks like and what that encompasses. So, for my capstone project, I wanted to get a better understanding of the client perspective and understand how OT is being perceived and if it is being integrated into healthcare at all. So, for my research question, it reads as, what is the level of awareness of OT as a resource for maternal health support among pregnant and postpartum individuals? And then as a secondary research question, I also wanted to know what barriers impact access to these services. So for my methods, I had a few models of practice and frames of reference that really helped guide my research because I created the all of the questions that I used within my research. It was a quantitative cross-sectional design. I was able to have 23 participants total. It was all through convenient sampling. I did a lot of community outreach and just trying to spread the word through social media a lot, as well as hanging my research flyer in pediatrician offices so that when moms are coming in, they have the potential to scan it and then take the survey. So in doing my questions, I really wanted to focus on 4 core areas, which were awareness of OT services, continuity of care, barriers to access, and perceived relevance of OT. And one of the things that really stuck out to me was this question that I input on my research poster, which was, I have received information about occupational therapy from my healthcare providers during pregnancy and or postpartum. More than half of the respondents disagreed that they did not receive any type of information about OT. They were not informed about it in any way. And for the individuals who did put agree, I had left one small comment at the end of my survey where if anyone wanted to, feel free to leave any type of feedback or share anything about their experience. They were more than welcome to do so. And so the information I gathered from that were the individuals who did receive information about OT were individuals who had either a complicated pregnancy or their child ended up in the NICU. So even then, occupational therapy wasn't being provided for the mom still, but more so for the child. So where does that put us now? From the results and everything that I found within my study, these findings suggest that OT is very much relevant and needed in this area, and it should be integrated into interdisciplinary collaboration. And in order to help enhance provider and patient education, something that I did in the deliverables was create a total of 10 flyers, which covered different topics such as feeding, sensory regulation support, pelvic health, sleep, occupational balance, role transition, and I did a few others, but this was to help increase awareness and access and improve the clarity of what OT really is and how it can be integrated into routine care for moms. What inspired all of this was my own personal experience with the maternal health care within the United States. I have a daughter myself, and I felt like OT was not being integrated at all, and I really wanted to bring awareness to our profession and help support maternal outcomes. So if you have any questions or would like to reach out at all, please feel free to reach out, say hi, or comment. I'm more than happy to be of future assistance to anyone who might be interested in this area as well. Thank you.